Today, we're getting under the hood with Dr. Tracee Burroughs-Gardner, a stepmother, daughter, sister, friend, and a committed professional in the fields of medicine, science, and psychiatry. In her most recent venture, she serves as the CEO of Urban Behavioral Associates, UBA, and the creator of Urban Wellness Society, UWS. Headquartered in Maryland, Dr. Tracee aims to provide an experience for her clientele, focusing personal enhancement through a rewarding journey to a solid foundation within mental health and wellness. Her guidance and insight are grounded in self-awareness, self-improvement, and personal evolvement. With a tenure that spans over more than 2 decades, Dr. Tracee has practiced throughout the United States of Maryland, Delaware, and the District of Columbia. Dr. Tracee has practiced throughout the states of Maryland, Delaware, and the District of Columbia. A board-certified psychiatrist with an extensive record servicing patients as a result of her personal practice and community involvement, Dr. Tracee brings her institutional knowledge to develop a transformative, life-changing experience, influencing her clientele to tackle personal challenges, everyday barriers, and roadblocks to success and happiness. Dr. Tracee received her Bachelor of Science degree from Howard University in biology, graduating magna cum laude amongst her peers. She later completed her medical degree from the George Washington University School of Medicine and completed her residency training in psychiatry at University of Maryland, Sheppard Pratt in Baltimore, Maryland. She is a diplomat of the American Board of Psychiatry and Neurology and is a distinguished fellow of the American Psychiatric Association. With more than 2 decades within the profession, Dr. Tracee has been rewarded numerous accolades. These accomplishments and affiliations all demonstrate her knowledge and proficiency in serving her clientele within the field of psychiatry and mental health and wellness. Wow, welcome, Dr. Tracee.
Thank you so much for having me. I'm excited to be here.
It's season 4, Women's March for Mental Wellness, and you've been doing incredible work. So if it's okay, let's get going.
Let's get going.
Awesome. I love this question. I ask every woman the question, but what's really unique is that you all have a different journey and an inflection point. And what was that moment that got you really interested in going down the mental health and wellness space?
Sure. I think about this question a lot because I always wonder, how did I end up here? When I first went to medical school, I thought I was going to be an OBGYN, right? I was really excited about women's health, and that's what I was going to do until I realized that OBGYNs are surgeons, and I had no place in an operating room, no role there. So I said, okay, that's clearly not the path for me. And so I was doing my different clinical rotations, and they were all exciting, but I was trying to figure out what spoke to me. And then I did an adolescent medicine rotation under my pediatrics. And I said, this is great. Oh my gosh, teenagers, they're so much fun. I love this. And I was prepared to apply to pediatrics. And then I realized while I loved working with the teens, pediatrics really didn't speak to me either. So I said, okay, well, what is it that I love? What is it about these disciplines that has the common thread? And I realized what I enjoyed was the psychosocial elements, the being able to get in there and work with people and really see what was going on in their minds and their hearts and their homes. And it clicked, psychiatry. And I've been on that path ever since, and I love it. I absolutely love it.
Oh, I love that. I think that's wonderful. And it's so interesting when you go in and you go on that journey and you have that moment recognizing surgery isn't for me. That's a lot to figure that out because it happens kind of quickly. So you go into psychiatry. Talk about that journey into that part of your medical training.
There's always a little bit of in the field of medicine. Are psychiatrists real doctors, or is it real medicine? It is. It is very much real medicine. But I navigated through some of that. Fortunately, I've had a good foundational experience with mental health and psychiatry even before I got to medical school, right? My Aunt Gail was one of the first licensed psychologists in the state of California. And, I saw her doing the work that she did. So mental health was something that was not foreign to me. I had great classes in medical school, and then my residency, oh my gosh, the University of Maryland, Sheppard Pratt is an amazing program for the development of community psychiatrists. Other specialty too within psychiatry, but absolutely within community psychiatry. And I was fortunate enough to work with some great attendings that helped me fall in love with community, which is interesting because when I first started my residency, I thought I was going to be a psychoanalyst. I thought I was going to have this beautiful office in Towson, Maryland, which is one of the suburbs of Baltimore, and I was going to do deep analytic work because, again, part of what I liked about this was getting really deep into the lives of people. But my first rotation in one of our state psychiatric hospitals, Carter Center, it's called Carter Center, it's now closed, helped me to see that there were individuals with severe mental illness in very difficult life circumstances that also had very rich stories. And that the work we did and do, because I still consider myself a community psychiatrist, the work that we did was just life-changing. It was absolutely life-changing. And I fell in love. Fell in love with community psychiatry. And that was what the vast majority of my career was until recently.
It would be really wonderful to share with the audience the experience going into community psychiatry, because that is really deep work and heavy work, very heavy work. So I understand it quite a bit and would love to hear your journey in that arena.
And so let me, I guess, do a little bit of definition first, because a lot of people may not know what we mean when we say community psychiatry. My understanding of community psychiatry is working with people, many of whom have severe and persistent mental illness, things like schizophrenia, bipolar disorder, very severe depressions. So individuals with severe and persistent mental illness that are living often in complicated social environments, right? Urban environments, impoverished environments. So you have the marriage of the complexity of mental illness, which we are still learning about, and the complexity of social factors. And what a community psychiatrist does is we try to get in there and say, okay, how can I help this person live their best life with as much joy and happiness as they can have, given the factors at play, right? So as a community psychiatrist, it's not necessarily my goal to eliminate all of the symptoms. Let me not say that. It is my goal. It is my goal. It may not always be possible, but that doesn't mean that people can't have wonderful joy and fulfillment and enriching lives. So as a community psychiatrist, that's always been my mission. And I've done that in various ways. I've done assertive community treatment work, which is kind of like a hospital without walls. It's a team of nurses and peer support, so people with lived experience, and therapists and supported employment workers. And we all just get out there in the community working with people, chicken coops in the middle of the woods, Baltimore blue lights where the police are. That's the kind of settings that we practiced in. So it was just great. We really were meeting people where they were. And when you meet people where they are, which is interesting because that's translated into other parts of my career. When you meet people where they are, you learn so much more about them, and you get to figure out, how can I help them? Coming into an office is great. It's wonderful. But when I can go into somebody's home and really understand who they are as a person, then I can make a difference. And then I'm practicing psychiatry at the highest level.
I'm kind of curious as we talk, and I love the meeting, your patients where they are, Dr. Tracee. I'm kind of curious, the system. So the system versus the individual. Can you talk a little bit? Because doing community work, it's wonderful that you are focusing on the individual, but the system at large has so many issues. And so I'm really curious to get your perspective and your experience in navigating both.
And, it's a false separation to say, we've got individuals with illness and then there's these systems issues. They are so interwoven. And in the beginning of my career, I worked at Healthcare for the Homeless in Baltimore City, which is a great shout out to Healthcare for the Homeless. And what I learned in that setting was you had kind of two types of individuals. One group who had just that kind of organic severe mental illness that helped lead to their disenfranchisement. But then we also had people who were disenfranchised, that the disenfranchisement led to mental illness and mental health concerns. And so they're so interwoven. If you have people living in poverty, and you have people with limited or no social supports, and you have people without access to resources or self-efficacy, it's almost a given that they're going to be depressed, that they're going to be anxious, that they're going to have panic attacks, that they're going to have what we like to call mood swings, which is a whole array of different things. It's almost expected. And so and this is part of the reason why I like going into the homes, because until we start to address the systems issues, or at least acknowledge that the systems issues are there, we are not fully assessing or addressing the concerns of our patients.
And you're right. If you're in an environment that manifests that level of stress, that level of anxiety, depression, all of that must be very interesting for you as a physician. How do you deal with that going in there?
It's tough work. It's tough work. And I think part of the way that community psychiatrists do what we do is we work in teams. It's very difficult work to do if you're trying to do it as a solo practitioner. And I've tried it that way. It's very challenging because you need the team for a couple of different reasons. Number one, the mental illness is not just all organic or neurotransmitter based. So there's no magical medication that if I can give this person this Zyprexa, it's going to make a difference. And I love Zyprexa. Zyprexa is great, but it's not enough. So the symptom presentation or the person presentation is more than organic. So it takes more than a psychiatrist. We need the psychologist and the therapist, right, to look at the emotional world of what's going on. We need the nursing staff and support to help manage other healthcare concerns and help educate the patient or the client about health. We need the support of employment because what we know about individuals with severe mental illness is that it's often not the mental illness that prevents them from working. It's the not kind of knowing how to work. You have to clock in, you have to be there on time, you have to wear a uniform. So knowing how to work and then just having the necessary supports. Great jobs. One of my favorite patients got Employee of the Month several times at Johns Hopkins. And he was very ill. He and his wife were both very ill. But with the supports of the team, he was able to maintain a job and do it at a level that got him Employee of the Month. It was great. It was great. And there's such great programs throughout the country that are really kind of understanding this. It used to be, and I know I'm going down a tangent with this, but it used to be thought that if you have schizophrenia, you will never be able to do anything. You'll never be able to do anything, just sit in the corner and die, essentially. Well, then we got past that. We said, well, maybe you can work. We'll put you in a place where you can put things in the little buckets, in the little bubbles, right, that are in the little toy machines, and you just sit and you put things in the bubbles, and that's the best you can get out of life. Well, what we know is if there's no hope, then of course you're never going to get any better. You're never going to have any life fulfillment and enjoyment. Well, now we learn, no. People with severe mental illness are still intelligent. They're not stupid. They just need added supports. So when we add those added supports, wonderful things can happen. There's a program, and I think they're still in existence in Long Beach, California, called The Village. I went out there years ago for a training. They have either a bakery or a cafe or something that is run almost exclusively by their consumers. And they do great work. I'm going off on a tangent. You were asking how we do this work. So you have to have teams around you to make sure that you're addressing everything, the whole entirety of the person, and to support each other while you're doing it. Because you need somebody to lean on. This is tough work. It's heavy work. So having a team around you and then paying attention. So I had to pay attention to myself. Was I getting burnt out? Did I need a break? Were my interests shifting? What was going on with me or what is going on with me so that I can always bring my best to the work that I do? And I still do community work. I work in several shelters in one of the counties right outside of Washington, D.C. But that is after I diversified my practice work to give me a little bit more diversity in the work that I was doing so that I could do that community work and not burn out.
I appreciate the notion of worrying about whether you burn out and what does that look like. And so that leads us to the next question, which is what are you working on? And talk, like, sort of take us on the journey of how you got there.
Yeah. So in addition, of course, to practicing community psychiatry, I found myself in a position where I still do, and run a practice. I was the medical director. My predecessor passed away, and the family said, look, Tracee, can you take this on and continue to do the work? And I said, sure, why not? I figure I could do it. I had no idea how to run a business. I've learned. So in that process, though, we've had to make shifts and changes. And so we went from being almost an exclusive community mental health center to diversifying into more kind of high functioning, quote unquote, worried well. And I use that with quotations because I don't really like the phrase, but I have to be able to differentiate from the prior work that we were doing. And in doing that, I started working with women who reminded me of my friends, of my family, and of myself. And that opened up an entirely new passion. I still have the compassion, the passion for community work. It's still there. But this opened up a whole nother, wow, I can really do some cool stuff with that. And I think it coincided with my own beginning of burnout journey. So I was seeing in them what I was experiencing in myself. And so I said, what if I could use my background as a psychiatrist to help people in ways that maybe Prozac or traditional psychotherapy can't do? So that is how I've ended up in this new realm of Urban Wellness Society and doing work with life goals, helping high achieving women achieve their life goals, looking at barriers that are blocking that life goal achievement and how to help them achieve the highest level of life joy and satisfaction. Really the same thing that I do in my community work, right? It's all about life joy and satisfaction in the context of whatever your life circumstances are. So really the same type of work, just two different groups of people.
The fact that you're able to transfer the experience, but also look at different types of, call them customers, different types of clients with similar needs. You want to talk a little bit about the universal through line and then the distinctions between each?
Absolutely. So one of the commonalities that I see between both groups of people is that they are groups that are often ignored and their needs are often overlooked. So that's really the common thread that I see. And both groups, and I'm really just kind of thinking about this as we're talking about it, both groups are doing their best just to make it through the day. Just doing their best to make it through the day in environments that are often not understanding or forgiving or accommodating of what their stressors or needs are. So that's one of the commonalities that I see between the two groups. Now, of course, on paper, they look very different, right? Socioeconomic differences and severity of illness differences are quite there. And of course, they make life easier or harder depending on the arena that you're in. But I feel like the skills that I have translate very easily because, again, these are people who are in need, who are struggling, who are trying their best. They're trying to figure it out and are often being ignored or misunderstood.
Like, how does that make you feel? But what I mean by that is that, to your earlier remark about very different socioeconomic backgrounds and circumstances. So the worried well could be these very affluent women with these big, high-powered jobs, but experiencing some of the same, that feeling of overlooked and those other things. So seeing that versus seeing someone in a community setting where their circumstances, it's almost like they didn't have a chance to begin with because their circumstances didn't start in a good, you know what I mean?
And, I think the common goal for both of them is, and not just them, for all of us, everybody wants to be happy. We just want to be happy. We just want life joy. As part of, again, trying to learn how to be a business owner, I was fortunate enough to participate in the Goldman Sachs 10,000K small business program. It was amazing. Highly recommend. But there was a part where we were talking about how to negotiate, how to enter into negotiations. And I'm very conflict averse. So the whole idea made me anxious. But our facilitator said almost everybody has the same goal. Everyone has the same goal. They may go at it in a different way, but everyone has the same goal. She said, if you were to talk to anybody, they would say they want to have a comfortable, a happy home. They want their children to be healthy and happy. They want their families to be healthy and happy. They want to be fed. Everyone has the same core goals. So when I think about these two groups, everyone just wants to be happy. And so the goal with both of these patients, whether I'm working with someone in a men's shelter or I'm working with someone who's meeting with me on her lunch break before she has to go into an executive meeting, what does happy look like for you? And how do we get you there? How do we get you there? It may be medication, could be. It may be intense psychotherapy. It may be more social activities with your friends. The Substance Abuse and Mental Health Services Administration, and they aren't the only ones that have done this, but I learned about it through them, it has something called the 8 dimensions of wellness. And the whole concept is if you attend to these 8 dimensions in your life, you can help yourself achieve joy and happiness and life satisfaction. And there are things like social, spiritual, economic, environmental, educational, etc. And so it makes sense to me. So, of course, it was first used with people with severe mental illness. But it translates so easily. I've done it myself. I have a spreadsheet because little known secret about Tracee, I love a good Excel spreadsheet. I have a spreadsheet myself where I have my 8 dimensions and I say, what are my global goals for each dimension? And I kind of check in with myself periodically. If I'm having a week or a couple of weeks where my mood isn't great, I'm really kind of in the dumps. Okay, did I attend to what dimension haven't I been attending to? And what do I need to do to help lift myself up? I feel like I'm going around in circles a little bit trying to answer the
I
question.
think this is great. And I think that's great information from an educational perspective. But what I think is interesting about it, Tracee, as you started talking about everybody just wants to have food, shelter, I started thinking of Maslow's hierarchy of needs. And is happy self-actualization? I don't think so. But it's somewhat, you know what I'm saying? But happy is feeling like those base level things are being, when you have that core level stuff, a sense of security and safety, right? And I'm not talking just physical, right? Right?
And it's interesting, and I'm learning this as I'm working more with my clients kind of in both realms. Sometimes the block to happiness is the lack of belief that you deserve happiness. And I see that with both sets of my patients. I see that with my high functioning women because somehow throughout childhood they learn that if they don't do X, Y, and Z, they haven't earned the right to happiness. So they're constantly grinding on this hamster wheel, trying to earn the right to breathe and be happy. So I see that with them. But then with my kind of community population, again, false distinction, but my community population, society has told them, well, you've got schizophrenia and you're poor. You don't deserve to be happy. You deserve whatever you get. And so sometimes it's starting with just understanding or allowing the individual to embrace you deserve to be happy. You do. And then we can figure out how to get to it.
And nobody signs up for it. Nobody signs up to have schizophrenia, to have depression. Nobody wants that. So it's like for anyone on the system, community, whatever level to think that it's just, which by the way, I know that it is thought of, but it's just horrifying to hear it.
Yeah.
Sense to me. So talk about your urban, your wellness program. How's that going? And what are you seeing? And what are you doing with it?
I chuckle because it's been in my head probably since at least 2017. That's when I found the earliest PowerPoint presentation, probably further back than that, because I also like PowerPoint presentations. I'm a Microsoft Office girl, apparently. Together my PowerPoint presentation. And I've been sitting on this idea for years. And for all the various reasons, I didn't feel like I could do it. I wasn't qualified. I had no idea what I was doing. I'm a psychiatrist. That's all I am. And then finally, I reached the point where I was sick and tired of how I was feeling. I was so burnt out. And I couldn't understand it because I love community psychiatry. I love my patients. I love what I do. But I was so burnt out. And I said, okay, Tracee, what does happy look like? The same thing that I tell my patients, what does happy look like? What do you need? What do you want to do? And the idea of this wellness. I was like, oh, you sure you want to do that? Do you know what you're doing with that? And I finally, through stepping out on faith, stepped out there and I've started launching these activities. And they've been going great. I had a handful of my personal patients that I said, hey guys, I'm trying this new kind of modality where I'm working with people. Would you be interested? And they all, yes, sign me up, please. I'll be your test dummy. We'll learn together. So that's been great. We're cultivating with a community partner cocktails and conversations with Dr. Tracee, where we talk about some of these topics and themes, imposter syndrome, joy, happiness, life balance, those types of things. We're going to start launching social activities. And that was the one I struggled with the most because I said, I'm a psychiatrist. Why on earth am I trying to have social events? That's not what a psychiatrist does. But then it made sense through conversations, through listening to podcasts, through talking to experts, that one of the best things we can do to help people's mental health and wellness is to give them community and socialization. So it makes perfect sense for a psychiatrist to do social activities and social events. So we're going to be launching those. And then just some kind of more general educational stress reduction, because we all have stress. We may not all get to burnout, but we all experience stress. So how do we navigate through that? So those are some of the things that Urban Wellness Society is doing right now.
I just love it. And congratulations, by the way. Good on you for taking that opportunity to branch out. I think when we talked before, you had mentioned in this particular case, you can work across. Is there going to be virtual opportunities? I think I might have someone for you.
So that's the cool thing. So through Urban Behavioral Associates, of course, that's my medical practice. That's where my medical license is based in house because I'm doing clinical diagnosis-based work. And so I am licensed to practice in Maryland, the District of Columbia, and Virginia currently. Now, what Urban Wellness Society is doing is not diagnosis-based, right? So it's not clinical practice. It's not medical work. So that can and go across state lines. So yes, I can do that work in a lot of different arenas and in a lot of different ways. And I have people doing work with me in that setting. So that's in development, but it's so exciting. I'm so jazzed by it.
And I think what's also interesting to me, Dr. Tracee, is the capacity, this whole so you said socialization. Is this going to be all in person? Are you going to have a mixture? Like, how are you imagining it?
So we're starting off with it in person, but honestly, it absolutely can translate to virtual. It absolutely, we did it during COVID, right? We did it during the pandemic. It absolutely can translate to virtual. And what that will allow us to do is exactly what you all are talking about, that community. Not just, okay, everyone kind of socializing, spending time together, but it's really allowing women and people to build community. And community is a protective factor. Community is a protective factor from trauma, from depression, anxiety, community, because we're social creatures. We're communal creatures by nature.
I want to ask you a question, and this takes you, well, I'll get to the marching for mental wellness, but this I think is an interesting question because it's about where we are in the United States of America. Well, let's talk about mental health and wellness and your thoughts on what we're experiencing right now.
I'm, of course, in what we call the DMV, the DC, Maryland, Virginia area. So we are right outside of the nation's capital. A lot of the patients I work with, a lot of my friends and family are federal employees. And so everyone's feeling it hard, but absolutely in the circles that I'm in, it's everything's hitting very hard right now. And the stressor for all of this is the unknown. No one really knows what direction things are going to go in. So when you don't know, it's hard to prepare. And when you can't prepare, you're floundering. And that's what I'm saying. People are scared. People are anxious. People are trying to prepare as best they can for something that we just don't know. And everyone's coming, not everyone, but my patients are coming to me and saying, Dr. Burroughs, Dr. Tracee, what am I supposed to do about this? Do I need more medicine? Am I going crazy? What's going on? And so first I reassure, you are having a perfectly normal response to a very abnormal situation. Perfectly normal response. And that's just, again, to normalize that no one's losing their mind. This is a normal response. What do I do about it? Lean into your community. Lean into your community. Lean into your community. When this first started, the case of many companies, I went back to the elders. My aunts and uncles, what am I supposed to do about this? What's supposed to happen? They've seen these types of things, right? They were in the 60s and they've seen these types of things. And everyone said, community, we rely on each other to get through this. We've gotten through this before, we can get through this again. So I tell my patients, rely on your community. And if you don't feel like you have that community, because not everyone is blessed or fortunate enough to have it, now's the time to start developing that. Reaching out to people or events or activities of like-minded people, develop the community. The second thing is trust in your own decision-making. Trust in your own decision-making. I've said this actually to several patients, and it's the mantra I live by, that I have enough faith in my ability to make decisions that when I get credible information, I know that I will act accordingly and do what I need to do. And that helps keep the anxieties at bay. Now, there are good days and bad days. So those are the things that I'm advising my patients of. Lean into your community, trust in your own decision. And whatever your faith system is, lean into that during this time.
And we know that the level of anxiety and everything's at an all-time high. So I get it. And so thank you for that. I think that's really helpful. So Dr. Tracee, how are you marching for mental wellness? And it can be you individually, you and your company, all of the above, however you choose to answer it.
So it's probably all interwoven, right? Because my personal is mental health, my business is mental health, my life is mental health. So I'm marching for mental health by, again, identifying where am I standing and how do I get to happy, and charting my course to get to happy, and then modeling that and helping develop a system for my patients to be able to have the same journey. So that way we're all marching to mental health and wellness together as a community. So that's kind of it's a short answer, but I think it's kind of the best way to summarize how I'm marching for mental health.
Well, I love the fact that you want to do it together with your patients. And I like the fact that even in today's climate, the goal is how to get to happy because, and I think this might be worth talking a little bit about, like if we can live in the present and have those micro moments of joy, because not everything is about joy, I mean, you know.
And I tell my patients all the time that you will not be blissfully happy 100% of the time. That's mania, and we have to treat that. But overarching, trying to develop a life with overarching happiness, recognizing that yes, we're going that sadness is normal. And I have to sometimes tell people that it's normal to be sad. When we lose a loved one, it's normal to be sad. Anger is normal. Many of us are angry at what we see happening in our country and our world right now. That's normal. Anxiety is normal, right? These things are all normal, but the goal is to have an overarching life picture of joy and happiness. And so how do we get there? And then how do we develop the resilience to be able to weather the sad times, the angry times, the anxious times, so that it doesn't pull us under?
There's so much uncertainty. We don't know. And I think that weathering that whole resilience thing and figuring out how to weather the storm. And I go back to what's interesting to me as well is if you can focus on happy, even in these bizarre times, like what can you get joy out of, right? Like despite it, like creating that bubble, if you will. What do you think?
And sometimes it's the small joys, like we're getting ready for Easter brunch. It's Easter, it's a big time of year, and we have all of our friends and family coming over on Sunday. We're going to have a wonderful brunch, and that's a spot of joy. Now, it's also a spot of stress because we're getting the house ready. But even in that, later this afternoon, I'm meeting a girlfriend for margaritas and Mexican food, and that's the spot of joy. So it's finding the happy spots and allowing yourself permission to have the happy spots. And again, especially with women, we feel like, well, no, I shouldn't. I should be working harder. I should be doing more. I shouldn't go meet my friend for margaritas. I should really be mopping the floor. The floor will be there tomorrow. It'll be okay. Go have the margarita. So it's finding those bubbles of joy. And I love the way that you said those bubbles of joy. If you can't live in a joy landscape at this moment, find the bubbles of joy. They're there if we look for them and then just kind of embrace them.
I think this is just such an important conversation and so timely. And I think it's timely, even if I reflect back on you, on the amazing work you've done, the fact that you're working both in community and with women who, think about it, both marginalized groups, if you will, who there's some common, the notion of being overlooked and trying to find ways to get them into a place of both giving themselves permission. You deserve to be happy for the people in the community and for women to give themselves permission, as you said, just to do anything.
One of my first conversations that we're planning is take the S off your chest, letting go of the superwoman syndrome, and how embracing that S is really blocking us from having joy. And then there's some things to look at. What about the S? What does it represent? Why are we keeping it? So there's a lot of things to look at. And I was talking with somebody else and I said, this is what I love about younger women who are very quick to say, I'm not doing that. I'm not doing that. And I applaud them for it. So it's encouraging to see what the next generation of women.
In that regards, our next generation is saying, yeah, well, maybe not for me. I mean, Exactly. Oh,
I think younger generation of men are also saying, hey, we're for this balance a little bit more.
Going to be interesting to witness it. I mean, because there's so much uncertainty for all of us. And then they're coming into this world, I mean, in very different, hey, listen, I mean, the way I think that we were raised, and I don't know where we are age-wise, but like you just sort of went about and did the things. It was just sort of it was very linear, right? And yet you were a career person versus now they call them portfolio careers where you could navigate in and out of things you're passionate about while maintaining a career, but not maintaining it just around one thing. And I think that's kind of interesting as well, because I think just the notion of the portfolio career concept promotes mental wellness.
I don't have to be locked in to this. I can use my gifts and my talents in multiple different ways. And as the tides shift, I can adjust and adapt and not feel like, again, the struggle I had, I'm a psychiatrist and this is what I do and I have to do it this way. Where a younger version of me might have come to the conclusion I came to a long time ago. That, oh, I'm gonna friendships and do some different things.
But you should be really proud because you've accomplished so much and you're doing so much good. You're doing so much good for society, for people, for humanity. And so, I just really applaud you. I don't want this conversation to end, but, we're sort of at a point, and this is a platform for you and a time and space for you to give a message to women of all ages, of all backgrounds, of all cultures. Dr. Tracee, what do you want to leave them with?
I would say first, there's a couple different things. You're not alone. Whatever you're feeling and experiencing, whatever your circumstances may be, you are not alone. Okay. Even if there's no one around you, trust you're not alone. And it's okay to say, you know what? I need a little bit of help. I need a little bit of support. It's okay to express your needs. And then it's okay to figure out how to get them met. It's that I just want to give women permission to be, and it's okay. It's okay to be. And there are other women out there like you, and not just women. If my husband were here, he'd say, I care too. Yes, there are wonderful men that care as well. But find your community, find your tribe, find your supports, and it's okay. You have permission.
Thank you so much for getting under the hood with me today. You're extraordinary, Dr. Tracee. One last question. How do people get in touch with you? How do people find you?
So probably the best ways right now are on Facebook or on Instagram. Urban Behavioral Associates does have a website, ubawellness.com. Urban Wellness Society had a website, but I was told by my husband that it is not good enough, and he is tweaking it, so that will be up soon. So that's not ready yet. But otherwise, you can find me on Instagram, Tracee Burroughs-Gardner. You can find me on Facebook, Dr. Tracee, 2 E's, like Diana Ross's daughter, Tracee Ellis Ross, 2 E's. You can find me there and absolutely reach out to me. I would love to connect with people.
Well, thank you so much. This has been just a wonderful experience. Thank you.
Thank you for inviting me.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, YouTube, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Matt Butler, and edited by Matt Butler. The music is by Ayla Schaefer. Her song, Rose.